Right. The cranial bones are the frontal, the parietal, and the occipital. The occipital. The temporal bones are the temporomandibular joint will be right here. The mastoid will be in here. See a little bit better. In here. Styloid will be in here. The external will also be in between there, and the squamous part will be in there. The sphenoid will be, the greater will be here, the lesser will be right here, and I think those two right. Okay, now the stitchers. So for the stitchers, I have the coronal. Let's put it right here. The coronal will be right there. The sagittal will be in here. And the lambdoid will be back here, right there. And the squamous will be right there. Okay, now the facial, the maxilla, turn this around, make it closer to his face. The maxilla will be right here. The nasal will be right there. The zymatic will be right there. The ethmoid will be right there, like that. And the vomer will be right here. The inferior nasal will be right there. And the mandible right there. What two bones form the zymatic arch? The cheekbone and the temporal bone. What two bones form the bony nasal septum? The carotid, maxilla, ethmoid. What does this the inferior nasal concha? What does this bone do? Flow air through the nose, in the nose. Okay. The vertebral column. Cervical vertebrae. State how many. There's 7. Point out the forecurve of the bottom. The forecurve. This will be the cervical vertebrae, the thoracic vertebrae, the lumbar vertebrae, and the fused vertebrae. The atlas. What does this bone articulate with from the superior? One of the superior surface of the atlas bone pair of the convex facets. Thoracic vertebrae. State how many? 12. Let's see. The spinous process will be in between, somewhere right there. The transverse will be in the bone in there. And the interval would be in there. The body of the sternum would be in here. So you can see it's a really good one. Okay. Interval foramen. What passes through these foramina? A number of structures pass through the foramen are the root of each spinal nerve. Dorsal root ganglion in the spinal artery of the segment artery. Sacrum. How many vertebrae fuse to this bone? 7. And the coccyx is 3 to 4. Okay. The sternum should be in there from inside the rib. So the mandrium will be, let me see, there's a better view. The mandrium will be up here in the top. The body will be right here. And the xiphoid process will be down here. Okay, the ribs. I'm just a little nervous here. So from the ribs, the true ribs will be from 1 through 7. And the false ribs will be from 7 to 10 or 11. The head will be up here. One of these ribs up here, the head will be right here. The neck right here, and the tuber circle will be right there. It's not a really good skeleton, but it kind of helps. And then it says here, explain how ribs articulate with the vertebrae. All of the 12 ribs articulate posteriorly with the vertebrae of the spine. Each rib forms 2 joints. Thank you.